All right, so one of the first questions I get asked by people is, how do you adjust the spine without any twisting, cracking, popping? Isn't that what chiropractic is all about? Well, first of all, before I answer that question, I want to make something very clear. There is no right or wrong way or good or bad way to adjust the spine. And just because people adjust the spine with the twisting, the cracking, the popping, some people like that, but the reality is some people don't. And I want to make sure that people understand that there is another way to adjust the spine that doesn't involve the twisting, the cracking, the popping, just so people are aware that there's another option. So when we talk about chiropractic and what it does, we use chiropractic to improve the person's wellness. And the way that we improve wellness is by adjusting or manipulating the spine. So we want to move the structures of the spine and the associated structures. And so a lot of chiropractors use their hands to do that. And that's a perfectly acceptable and a very effective way to adjust the spine. But there are some patients that don't prefer that and they're looking for alternatives. And so what I use in my office exclusively is this. I use what's called the Impulse IQ. And so the reality is I basically screen the patient the same way I would if I were to adjust by hand, but then when I find the area that I want to adjust, instead of placing my hands on the patient, I use the Impulse IQ and I place that on the area that I want to adjust. And the end result is that it's a very safe, a very gentle, and a very effective adjustment that's very comfortable for the patient because I'm not over or under adjusting them. And the end result is that the patient feels really good, and they feel comfortable, they get up feeling comfortable, and they find that their relief is very real and very long lasting. I love it. So what I'm going to do, if you continue watching, I'm going to show you a demonstration where I use the Impulse IQ on my daughter and adjust her back and show you how it's all done. So just go ahead, keep watching, and I'll show you how I use the Impulse IQ to adjust patients. I'm here to show you how I use the impulse adjusting instrument to adjust my patients without any twisting, cracking, or popping. Now the nice thing about the Impulse IQ is that it has a small microprocessor in it, and so what it does when I first pull the trigger is it delivers an impulse, and then that impulse is going to measure how fast and how much that joint moves, and then as I continue to hold the trigger, it's going to start to impulse, and it's going to speed up or slow down to match how fast and how much that joint is moving. And then once it records 3 impulses where you see no change, then the impulse will beep, and then the adjustment will be completed at that level. So my daughter here, Brianna, is going to be my patient for today, and so I'm going to ask you, Brianna, what do you have that's bothering you today?
My back.
Okay, where in your back? Mid-back, low back, upper back, neck?
Lower back.
Lower back. Okay, go ahead and lie face down. So the patient is going to lie face down in this position. And they don't need to really move from this position at all. So hopefully they're nice and comfortable and they're relaxed in this position. So what I start off by doing is trying to determine if there's a side that's bothering the patient. So for low back pain, I'm just going to bend the knee. I'm going to say, do you have any discomfort or pain in your low back when I do that?
No.
Okay, and I'm going to just bring up this one. Do we have any pain or discomfort in your low back when I do this?
No.
Okay, so what I'm going to do then is I'm going to bring up the legs here, and she's about equal, but it looks like this right side is slightly less movable than the left. So that tells me that the problem is probably going to be over here on the right side. So what I do is I take my impulse. Now the impulse actually has 3 settings as far as force is delivered. And with a child like this and her being of slight build, I don't really go all the way up to the top. So what I'm going to do is I'm going to come in here and I'm just going to apply the impulse here. And I'm going to start with that. Was that comfortable?
Yeah.
Okay. Any pain or discomfort as I start with that?
Yeah.
Does that hurt when I do this?
No, just my joint.
Okay, so I'm just going to come in here and I'm going to impulse. And now it beeped and the adjustment is done. So I'm going to come over to this side, same thing, same place. And you can see the adjustment is done. That was it. That's all the adjustment is. Now I'm going to come up in here. I'm going to apply activator instrument here. And I'm going to apply it right here. And you can see every time it beeps, the adjustment is done. Now I'm going to come up here And I'm going to place my hand here. I'm going to slide up. Any pain or discomfort as I come through here? Right about there.
Yeah.
Okay. So I know that this is about the place, so I'm going to find location right about there. Okay, so I just come put the impulse right here. And in the interest of time, I'm not going to hit all the spots, but I just want to show you typically what I do for someone with low back pain. And so I'll come in here on the other side where I feel another problem. And that one adjusts a little bit better. That was a little bit faster. So you can see that the impulse is going to speed up or slow down for each individual joint. Okay, coming up on the neck is something that people are usually very nervous about when they get adjusted. And this is so excellent because there is no clicking, no popping, no twisting, no anything. So what I do is I come in here and I find a spot in the neck. There's a spot way up here that's a little bit tender, right about there. Okay, so what I do is I come and put the impulse on the neck, and I just come up here on the lowest setting, and then I just come up like that. That's all it is. That's all I'm doing when I adjust the neck. Just nice and easy. Nice and gentle there. How's that feeling?
Good.
Yeah, it's no problem. So this is really good for kids. This is good for the elderly. It's good for all populations because it's very gentle. No cracking, no popping, no discomfort. Just really nice and easy, nice and gentle. There we are. So you can see that that was about 8 hertz, so about 8 times per second, and it took that many impulses. What I love about the impulse is that you don't over or under adjust the patient. What you're doing is you're giving the right dose, so to speak, of the adjustment to the patient. But you can see very well for yourself how the impulse IQ works. And it's very gentle, and the patients love it. It feels kind of like a gentle massage, and it gives the patients quick results, very gentle results, and I wouldn't trade it for anything. Thanks a lot for watching. Take care.